The voice behind the masters, the master of modulation, the sultan of sound.
Dr. Narottam Puri has been the face of sports on Doordarshan in the pre-cable television era. A Maulanian to the core, he has worked as assistant professor in the Department of ENT, Lok Nayak Hospital. But that's just one of his many faces. A teacher, a sports journalist, a quiz master, an expert cricket comparer, and author of more than 18 books. You name it, he has done it. Nicknamed the Encyclopedia of Sports, he has been the recipient of several awards and recognitions, notably FICCI's Healthcare Personality of the Year 2013. The seniors sitting in the audience here know him very well, and there is not a single person here who is not a fan of his. The octogenarian whose enthusiasm for life belittles his chronological age. The perennial anchor of IS Bal. Sir, the stage is now yours.
Can you hear me? Yeah. Good afternoon, ladies and gentlemen. To all the teachers here, my best wishes, my regards. To all the seniors, particularly those who, there won't be anybody from my vintage, but all the seniors of this college, I know some of them are here, Dr. Tripathi, Dr. Siddharth Ramji, of course, and the MAMC's president, he's also here, Dr. Satraval. I don't know how I can better what you've heard, because Dr. Batra, this was magnificent. This was, you are a Pandit, in addition to being, you know the Vedas, you know spiritualism, you took Guru and Shishya, a teacher and a disciple, to an altogether different height. Thank you very much. And Dr. Singh from KEM Hospital, I wish you were a Maulanian too. I'm quite sure many in the audience would grant you an honorary status, because you definitely honored this stage by your presence here, and for the good work that you're doing, we are grateful, not just as doctors, but as citizens of this country. When I was contacted, I guess I was contacted because of the fact that A, I'm a Maulanian, but I graduated in 1968. So probably your parents would be of that vintage, or maybe junior. And this stage was built in 1966, and I happen to be one of those who was present on the first program that we did on this stage. So this is very much like my Karam Bhumi. So thank you for inviting me, because there can be no greater honor to an ex-student and an ex-teacher to be invited back to his alma mater. When I was invited, I thought, and it was discussed, that probably you'll want to hear of my days as a commentator or a quiz master, etc., or a radio commentator. But I've chosen a subject which actually translates into many fields. It's a part of communication, but I'll be focusing more on communication in healthcare, because I feel in today's environment and days, this is at least partially responsible for some of the ills that have befallen our community. The violence against doctors, the indiscipline of some of our brethren, the problems that the patient faces, the issues that you're reading every day in the newspaper. Perhaps they can be mitigated to some extent if we understand the value of communication in healthcare. So here goes my attempt. Communication essentially is a means of exchange of information from one head to the other, from one mouth to the other, and it's a sharing of ideas, just as we are sharing now. It has three major components: speaking, listening, and non-verbal communication. Now, speaking we are all familiar with, but listening, now this is a congenital disorder, particularly in this country. And this is with rare exception. You know, it happens 5 years after your marriage. But that occurs at a particular frequency. The wife doesn't hear what the husband says, and vice versa. It also happens in our politics, Dr. Sambit Patra being an exception, because the general public thinks the politicians don't listen to them. And there's a general feeling that listening is not part of communication. Because whenever we listen, we actually listen to answer rather than to understand. We are already thinking as we are hearing, what should I be answering? So that is the problem with the listening part. But it is the third part which to my mind is the most important part of communication, and that is the non-verbal part. It is how do you use your eyes? How do you use your hands? How do you use your body posture? The same posture, the same words said in a different body posture and without meeting your eyes will have a different meaning. And this has huge connotations in healthcare practice particularly. Another part of communication, these are some of the things that we all know about. For example, there can be no communication without words, vocabulary, a certain amount of emotion. The enunciation and the dialects are very important. The speaking position I've just referred to. Now, I can give you an example of dialects and the subject of the problems that we have when we move from one area of the country to the other. It was in physiology, and for the first time to a boy who was 17, 18 years of age in Maulana Azad, I was faced with an external examiner, and this is no aspersion, by the way, to Bihar, but my external examiner was from Bihar. And the question he asked me is, how much of urine is excreted in a day? Now, I heard this to mean how much of purine, you know. So for a split second, I thought that, why is he asking me a question of biochemistry and physiology? But it never occurred to me that he was meaning something else. It was just his dialect, because instead of the way, how much of urine? So I said whatever 0.2 milligram or some such thing. So he looked at the internal examiner and said, पागल हो गया क्या ये लड़का? ये मर नहीं जाएगा kidney failure से? So I said, sir. So the internal examiner told me that he's meaning urine. So I said, that's easy. So I told him how much of urine. Next he said, tell me the functions of liver. Now I heard this to mean functions of labor. So I said, that's easy. It's to expel the child. Now he looked at me like this and he said, Pagla gaye ho kya? And I said, sir, that's the function of labor. So he said, then my internal examiner again intervened, कि नहीं जी ये लड़का ठीक ठाक है. And he's asking functions of liver, जो आते तो हैं. So I narrated what are the functions of liver. Anyway, I got a supply in physiology. Don't judge me too harshly. I ultimately ended up getting a gold medal in my subject, in MBBS and MS. But it was this problem, the dialect and the enunciation, that did me in. So don't fall prey to that. Now the two parts that I've written as numbers 8 and 9, that is the medium or the last part of sentence. These are some things that I learned in my broadcasting career. Now it's very easy when you're sitting all in a hall and I'm speaking with a good volume mic, but there are different kinds of mics. And if you are suppose doing a commentary in a Firozshah Kotla or an Eden Gardens where there's an effects microphone that's lying out there, that carries the voice of the public. Now that voice is so large in the effects microphone that if you don't shut up, your voice will be drowned. If you are a novice, you start shouting more and more. If you are experienced, you keep quiet. Let the noise take over, the sound take over. That conveys the image. Radio, it's your words which create an image. In television, you don't need it because the visual medium gives you the picture. You only add words to embellish the picture. So it's very important to know where you're speaking and how much you're speaking, what is the ambient level of noise. That's good broadcasting. Last part of the sentence is, if you've noticed, all of us, when we are speaking, we tend to reduce the volume of our voice. Now notice my voice as we come to the end of the sentence. So the sentence word is the least decibel. But if you hear Lata Mangeshkar sing, every word rings true. The reason is good broadcasters, good public speakers know that we tend to eat the last part of the sentence. So we elevate the volume of our voice consciously. Do pardon me, I'm a little breathless because I've just 2 weeks ago had an angio. So my heart is not the best. Probably I did not do Lom Vilom during my days. So, and again we come back to the non-verbal part. You will notice that there are 1 or 2 things that I have not mentioned here, and that's deliberate. One part of it is humor. That's less important in medicine, but I still think it's important. When was the last time that you went to a doctor who smiled at you? No, nobody will remember. Because somehow, when the patient comes to us, the patient is already ghabraya hua. But he looks at us, he thinks, mere to mohta gayi. Because we are so stern. We believe as soon as we don the white coat that we have to be very, very serious. Just as the judges, when they wear this thing, they believe that they are imperious. So I think humor has a place. I don't mean to say that when you are giving bad news about somebody's loved one dying, then you are smiling. But what I mean to say is that relax a little. Humor has a great value in any communication if it's natural. If it's introduced, then it becomes a problem. Because wit is not something that you can introduce unless and until you have it in you. I'll give you an example from cricket. A long time ago, all of you must have heard the name of Don Bradman. Now, Don Bradman was a great batsman. His last series in England was in 1948. And he was scoring runs like anything. The captain of England was a chap called Norman Yardley. Now, when he was the captain, he didn't know where to set the field, which bowler to put, because Bradman was scoring runs like by the dozen. So the cricket commentator on television made one cardinal error. In television commentary, one principle is you always speak to the picture. So we have a television set lying in front of us. We have one eye on the ground and one eye on that. But you always talk on the picture only because the picture is the only thing that you guys are seeing. Now this commentator made the mistake and he said that Norman Yardley must be scratching his head to find a solution to this problem. Now, the camera panned to show Norman Yardley. Unfortunately, at that particular moment, he wasn't scratching his head, but the opposite part of the anatomy. And here is where wit came to the rescue. You know what the commentator said? As soon as he saw the picture, he said, "Well, I told you it was a ticklish problem." So humor has a lot of place in any kind of a communication, and it is often ignored. Now, communication must be hot. Now, not the hot that you mean, but the hot I mean. It must be honest, it must be open, and it must be two-way. Not like in this cartoon. This is of a much married person. But in medicine, it's very important that we are honest in today's world today. I have this, I took this slide from somewhere and I think it very well explains what I mean. Solar. If you remember this word, smile as often as you can, have an open attitude, lean forward, not too much if you're talking to a lady, have eye contact as far as possible, and just have a relaxed attitude. So solar is something that you remember. This is the problem. This is a major problem in the world today, and it's a problem in healthcare. As I move into my healthcare part of the communication cycle. The biggest problem with communication is the illusion that it has taken place. We all believe, हमने बता तो दिया था patient को या उसके relative को, नहीं बताया. So this illusion is resulting in a lot of problem, particularly in science. And the single greatest tragedy in health and science right now is the inability to communicate well. This is a report from the Institute of Medicine, which is in USA, highly respected. And amongst the various things that this report talked about, the importance of communication was highlighted as very important in a patient-doctor relationship. Why? The reason is that communication failure is the leading cause of inadvertent patient harm. It is present in more than 75% of wrong site surgeries and delays in treatment. It is present in more than 60% of medication errors. And in obstetric cases, 72% breakdowns resulted in neonatal death. 30% of all malpractice suits in USA are because of communication failure. And according to an Accenture report recently, US hospitals waste $12 billion a year due to poor communication. You can only imagine how much we are doing because we don't have the kind of data. Of the Sentinel events. Now, Sentinel events, I hope you know, are those which result in harm to the patient, resulting in death or huge morbidity, which is not because of the disease. JCHO, which is the accreditation body in the United States, came out with this report that 65% of all Sentinel events are because of poor communication. This has a huge impact on patient safety, but it is the last part that I want you to focus on. And that is, most communication problems occur between doctors and nurses. And this is why. Ineffective communication between nurses and physicians causes distractions during care delivery and contributes to medical errors and inefficiencies. Why does this happen? This is very rampant in India, but why does this happen? This happens partly it's because of our national culture. We rate nurses in the social hierarchy very low. Doctors consider them much, much higher. The second is doctors have a huge degree of autonomy as far as decision making is concerned. The nurses don't. Third is that in the hierarchical structure and the power structure and the way they are educated, the nurses learn narrative descriptions or description that they need to give. But the doctor, being a problem solver, just wants facts and he wants it in a nutshell. There is no mixing between the doctors and nurses, so there is no team training. And our handoffs, if you've ever watched a nurse give charge to another, she will usually say, Chechi, शाहरुख की लेटेस्ट पिक्चर जो थी ना उसके अंदर ये हो रहा था, इस पेशेंट का ना टेम्परेचर रात को 106 हो गया था, मतलब in Malayalam. So this is a common problem that we tend to mix social chit-chat with takeovers, and high-risk issues therefore do not get clarified. A recent study has revealed that an average patient recalled only 40% of information that he received either from a doctor or from a nurse. So at the time of discharge, you tell the patient, this has happened to me very often. My physiotherapist tells me 10 sets of exercises to do. By the time I come home and try and do it, I realize that I've forgotten half of them. And it is a study which recently came out, and it shows that on an average, patient recalls only 40% of the information that he receives, and 50% of what he remembered was actually incorrect. Now, in today's environment where there is comorbidities, you find that this is a recent study again by IOM, Institute of Medicine in Boston, that an average surgical patient during the course of his stay in the hospital interacts with 27 healthcare workers. It doesn't mean a doctor, but healthcare workers, right from the time of admission to discharge. I don't know why this is not working. I'm not one of these 27. Yeah. Between the patient and the doctor, this is an interesting statistic, and this doesn't bode well for our profession. A physician interrupted patient's initial statement when he begins to tell you what his problem is 77% of times. First sentence is interrupted. And the average time a patient was interrupted by a physician in a consult was after every 18 seconds. Assuming that in the United States, an average consult lasts 20 minutes, you can imagine the number of times the patient is interrupted, not allowed to tell his story. This is by Bradman and Frankel. So, whether we agree or not, there are communication issues affecting us. And these are very, very prominent when patient transfers take place. You remember how easy it is to transfer, during my days at least, it was a hell of a job transferring a patient from Irvin Hospital to GB Pant Hospital and vice versa. And it used to take a day and a half, because it was very difficult. This was a landmark case which changed the entire way the Americans believed and made everyone believe that communication between doctors amongst themselves, amongst doctors and nurses, and with patients needs to change. This is the sad story of a 38-year-old woman who came to Mass General Hospital in Boston, Harvard institution. And she ended up with all kinds of complication, a ruptured uterus, a dead infant, and disseminated intravascular clotting, which required 18-day stay in the intensive care unit. The problem was communication problems, resulting in all sorts of communication failures, resulting in this patient getting about $2.7 million in a medical negligence case. But what it did was, Harvard did not shovel it under the carpet. They made, in fact, they made actually a dramatic version of the entire event of this. And when I went as a visiting professor to Harvard in 2010, they proudly showed this picture and said, this is what we did wrong. They called in the US Marines and said, how do you deal with communication problems? They showed them this case. And this was the landmark case that changed the way a lot of thinking in quality and safety went in Harvard and in the United States after that. This is the big question that we need to answer. Is communication an art or a science? And if it is, particularly if it is a science, can we learn it? In my opinion, communication is an art. But there is increasing evidence that there is a science to it by which anybody can actually improve on what the problem of communication may be in his or her mind. And these are the 4 parts of it. One is what is called Sbar, structured communication. Second is critical language. Third is assertion. And fourth is debriefing. Sbar stands for situation, background, assessment, and recommendation. This is particularly relevant in healthcare setting. Now, what does this mean? Let me give you an example. So the situation says, Mr. M has sudden onset of radiating chest pain and shortness of breath. That is the situation. And then, what is the B? That is the background. So this is the background. his vitals are XYZ, and this is the assessment. A, I think Mr. M may be having an MI. And what is the recommendation? I need you to come evaluate the patient. How soon will you be here? So this is a science by which you can improve the communication. Second is critical language. Always use key phrases such as stop, I have a problem, or we have a problem. United Airlines has this program called the CUS program. This has 4 stages. One is I'm concerned. So that's C. I'm uncomfortable. That's B. I feel this we are unsafe. C. And fourth, I'm scared. And everyone, whether it's pilot or it is ground staff or it is any hostess, knows this CUUS system. There is also a system by which people just stop and say, I need clarity. Whatever you do, just make sure that there should be no surprises. Assertion is that to speak up and state your information with appropriate persistence until there is a clear resolution. Don't say in an aggressive or hostile manner, don't say in a ridiculing manner, and don't be confrontational. So this is assertion. And last is debrief. This is underdone in healthcare settings. We don't get together. Even in mortality meetings, we are usually either trying to put the blame on somebody else why the patient died, or we are not trying to learn. And what is important in debriefing is not just to learn from our failures, but also from our successes. Communication is useless in healthcare without teamwork because it's a complex environment. There is uncertainties, there are surprises, there is incomplete information, there are interruptions, there is multitasking, particularly in government hospitals. We should learn from other industries. Aviation industry has made certain recommendations which are increasingly being used in healthcare. But healthcare as an industry is slow to respond to changes. Probably the slowest to respond to changes. And surprising because healthcare changes most rapidly than others. When I was here as a student or as a teacher, there was no ultrasound, there was no CT scan, there was no MRI. So we diagnosed brain abscess on the basis of clinical findings and an X-ray. We put in a needle while doing a mastoidectomy in the belief that we'll strike pus. We didn't know. Today we'll be sued left, right and center. But these modalities just weren't available. So my point of saying this is that whilst we are doing this, we need to be cognizant of where we are. I can't expect Dr. R.K. Singh when he's working in Kokrajhar to have the facilities of all these methodologies available, but I'm sure he'll agree with the first statement that 74% of all commercial aviation accidents happen on the first day of a crew flying together. So if you're a team, your team working together, you always will create lesser problems because you communicate well with each other. But our definition of communication or teamwork changes. A nurse thinks good teamwork means you're asking for my input about the patient. Whereas a doctor thinks good teamwork means the nurse does what I say. So I've given you problems. I also need to reach a stage when we need solutions. So what is the way forward? Well, one way is to increase use the digital data that is available now. All of us are computer literate. EMRs have come to stay, at least in corporate hospitals in India. EMR is standard. Electronic prescription systems are almost standard. And automated medical reimbursements and automated medication reconciliations are happening. Patient engagement tools are increasingly being used, and technology is being used for interactions between various things like telemedicine, for example. And last but not the least, we need to follow examples by good institutions like Weill Cornell Medical College, where they have what is called Making Care Better. And they have 13 core elements which focus basically on communication and collaborations between doctors, nurses, and various healthcare teams. So what do I suggest? What do I recommend? As I was talking to Dr. Ramji, and I need to compliment those who have thought of Gurukool, not just because it's such an innovative name, but and also makes me feel cool. But important thing is that you are thinking along the lines that a lot of people in the medical world in the West are also thinking. Recently, Penn State Medical College became the first medical college in the United States to have a department which they called the Department of Medical Humanities, which had nothing to do with medicine. It was exactly what I heard one of you talk about, what Gurukool intends to do. Get people from different streams of life, like you've done today, to come and talk to them about art, about music, about various other things that you are interested in. It doesn't need the government or the MCI to tell you to create this department. And I suggested to Dr. Ramji, who himself was thinking along the same lines, that if he would permit me, I and my family, we are 5 Maulanians. You know, my wife is here, my son is a Maulanian, my daughter-in-law is a Maulanian, my sister-in-law is a Maulanian. Incidentally, this will be her 50th year celebration on the 20th of December. We as a family would put in a seed money of ₹1,00,000 to start this Department of Medical Humanities, and I promise that if you invite me, I'll be happy to come and talk about it, as also get other speakers from various parts of this thing too. So please start this department. This is still such time that MCI agrees to have communication as a subject in the undergraduate curriculum. It is there in England. It is there in many European countries. It is there in US, but we don't have it. So there are 3 things that I believe MCI needs to introduce. One is communication, second is quality and safety, and the third is basics of finance. These need not be a part of examination system, but they need to be optional subjects, either in the MBBS curriculum or in the internship program. This is my suggestion to do that. You will be surprised to know that 61 universities in the United States have now started offering combined degrees called MD MBAs, because they realize that administrative medicine is a different subject. Otherwise, you start blaming the medical superintendent for every loss of life that occurs, whether in Gurukool, Farooqabad, or anywhere in Delhi. The poor fellow is probably the senior most doctor who has been put into the medical superintendent's job. He has no administrative background, he has no management experience, he doesn't know finance, he's never studied any of these. He's just a great doctor or a senior doctor. So, till such time that we have this, either we have administrative medicine as a separate subject in undergraduate or postgraduate curriculum, and then select your administrative medicine people from there, or you introduce these subjects in UG curriculum so that there is some introduction to communication as a subject. Then from management you need to learn standardization, what are called SOPs, standard operating procedures, when handover communication occurs between nurses to nurses and doctors to doctors. And use of these 4 tools that I told you about, the science of communication. And teamwork, and last, I just want to skip to the last 2 lines. The use of educational tools like TeachBack. Now, TeachBack is a system in which at the time of discharge, one member of your team, any departmental member, actually talks to the patient or patient's relatives and asks him, "Kya samjhega?" about the prescription or what has been done. So this is the teach-back mechanism, and this has been proved that 40% understanding and 50% remembrance that I showed the slide of earlier improves to 80% by this teach-back. Last but not the least, please learn from other industries like we are beginning to do now. There is a pilot checklist. I'm told that when the pilot and the co-pilots sit in their positions in the aircraft, they go through some 43 or 45 checklist points. Why don't we do this in medicine? Well, we've started doing it. Atul Gawande, who's got out this checklist that's been approved by WHO, and Pronovost. Atul Gawande is at Harvard, and Pronovost is at Johns Hopkins. They've come out with checklists, and these have become now standard. Last 5 slides of what I have learned over the last 54 years that I've been in the medical world. Summarizing what I mentioned earlier, my belief that it's body language, and this is confirmed by University of Pennsylvania study, that communication is 70% body language, 23% voice tone, and 7% words and inflections. That is how you express. So if your expression is just by words alone, you will never leave a mark. But if your body language and your voice tone are such that they attract the attention of the audience, then you won the day. This is important in healthcare, and this is what I've learned, that people may or may not hear your words, but they will always feel your attitude, particularly a patient. The patients don't care how much you know until you show how much you care. That is the crucial part. And this is all by attitude or empathy. Martin Luther King said that our lives begin to end the day we become silent about things that matter. So if you're hearing a senior doctor say 1 milligram of a particular drug when you know the dose is 0.1 milligram, speak up before the patient loses his life. We've all heard of reading between the lines. Doctors, good doctors, learn to say things and hear things without their being said. It's very important that this is Peter Drucker, of course, who said that, the management guru. But in communication, if the message is conveyed, that is the key. So it's important to hear what the patient isn't saying. It's not easy for a patient to express. It happened with me in my final MBBS exam, Obs Gynae. I was given a young girl who was infertile. Yet she had come from a hill tribe. She wouldn't open up. During those days, I'm talking of 1968. She just wouldn't tell me the history. So you have to understand what is going on in the patient's mind. And without being said, as Dr. Patra was mentioning, sometimes you have to just have that communication, which he described between Meera and Surdas. I've heard this a lot, that you guys who are working in big corporate hospitals can do all this thing, electronic medical records, etc., etc. But I believe Gandhiji was right. Be the change that you want to see in the world. And you are capable of doing it. We all are capable of doing it. That is my belief. My belief is that medicine must now start showing the way to the rest of the world. I'm glad that Dr. Singh is doing such great work. Dr. Sambit Patra is representing very well in the parliament and on the television shows. But collectively, I think our voice is not heard as much as it should be. It is partly because of the fact that we do not communicate well. So let's start to communicate. Thank you very much.
Thank you, sir. The healing touch of the words of a doctor comfort more than medicine. Thank you for teaching this to us, sir. This is what Gurukool is all about.
अब मैं आदरणीय डीन सर को डॉक्टर पुरी को सम्मानित करने के लिए मंच पर आमंत्रित करना चाहूँगा. सर आपके लिए एक स्पेशल शेर। नर उत्तम ज्ञान उत्तम, उत्तम करे ही जाए। नर उत्तम ज्ञान उत्तम, उत्तम करे ही जाए। स्वर विशेष ज्ञान विशेष से सर्वोत्तम कहलाए।